Okay, so we've already covered a little bit of active release technique and Graston technique for the knee. Now we're going to show you some KinesioTaping for the knee, and we use rock tape. Now, a lot of people may or may not be familiar with KinesioTape. It's these just long strips of tape, but what makes this different than your typical white athletic tape is that KinesioTape can stretch. And depending on how you tape, how you use it, it can do so many different things. It can decompress or it can compress. It can help with lymphatic drainage of a swollen knee, things like that. So the taping I'm going to demonstrate right now on Terrence is going to be a knee stabilization protocol. For again, if there's dysfunction with the quads especially, it's manifesting as patellar pain or pain along the joint, this is when we would do this protocol. Now if the knee was swollen, we would do a different protocol, but that would have to be a different video. So application is quite easy, and we can get to the point where once we show our patients on how to do this, they can actually go home, purchase the tape, and then go home and apply it themselves if they need to. So for this one, I go down onto his tibial tuberosity, we put our anchor strip, and then just with a little bit of tension, it's almost like I'm surrounding his knee and coming up onto his quad. And then the nice thing about this tape is actually when you rub it, you activate the adhesive with the tape so that it sticks better. So we're just going to rub it around like that. And then we're going to do the other side. But we do this all around the body. Shoulder stabilization, obviously knee stabilization. You can do this for ankle instability as well. I mean, I think there's pretty much every part of the body we have taped at some point. And we're going to come up here, almost where it forms like a diamond. And you can see as I'm going, it stretches a little bit. It's pretty pliable. And then this is what we call our decompression strip that we would put. If he was feeling the pain on his patellar tendon, like many do, we come over, we just do a little bit of tension down, and then we end up pulling our anchor strips on either side. Beautiful. So this is just one example and type of KinesioTape or rock taping protocols that we do, especially to help with knee pain. The one thing I will say about KinesioTape is it's temporary. It's not supposed to be something you do every day. If you're using it every day when you're working out, you're using it as a Band-Aid, and that's not how it's supposed to be. It's supposed to help re-educate the tissues. It's meant for temporary use. So that's my little bit on KinesioTape. The last thing we want to demonstrate to you today is some of our physical rehabilitation.